personality disorder is a mental health condition where people have a lifelong pattern of seeing themselves and reacting to others in ways that cause problems. People with personality disorders may often struggle to understand emotions or tolerate distress. This makes it hard for them to relate to others, causing serious issues and affecting their family life, social interactions, work and school performance, and overall quality of life. As you can see, personality disorders have far-reaching effects on a person's life. But how did it get to be that way? What causes personality disorders and how are they treated? There is no known cause for personality disorders, but it is believed that it involves a blend of how a person's genetics and environment affect them. Genetics may make it more likely to develop a personality disorder, and what happens in a person's life may set a personality disorder into motion. There are also a few risk factors in what can lead to developing a personality disorder. Specific personality traits like always trying to stay away from harm, or the opposite, always trying to seek an adrenaline rush, may be risk factors. This includes poor impulse control. Early life experiences may also be a risk factor, such as living in a home environment that is not stable, predictable, or supportive. Also, a history of trauma, physical neglect or abuse, emotional neglect or abuse, or sexual abuse. For many, a combination of treatments works best, such as psychotherapy, otherwise known as talk therapy, which can be done in an individual, group, or family setting. Cognitive behavioral therapy, also known as CBT, which is a therapy that makes you more aware of your thought patterns, allowing you to be better able to control them. Dialectical behavioral therapy, otherwise known as DBT, which is a therapy closely related to CBT that teaches you skills to better handle your symptoms. Psychoanalytic therapy, a therapy focused on uncovering and resolving unconscious or buried emotions and memories. And psychoeducation, a therapy focused on helping you better understand your condition and what it involves. Medication is another treatment. There are no medications specifically approved to treat personality disorders, though certain medications may be used to treat symptoms. The best medications for treatment depend on individual circumstances, such as the severity of symptoms and the presence of co-occurring disorders. Many people with personality disorders have multiple conditions, and these often include other personality disorders, substance use disorder, anxiety, and depression. Medications that are typically used include antidepressants, anti-anxiety medications, mood stabilizers, and antipsychotics. Now, this was a bit of a shorter video because I am coming to the end of this series. This, I believe, is part 4 in my series about personality disorders. And this is just a bit of a broad overview encompassing all the clusters and all the disorders because there are some similarities across the board. And I believe that the causes and treatment tend to have the most in common with each type. Of course, there are differences. For instance, with the cluster A personality disorders, which are characterized by odd and eccentric behavior, you see a lot more cases of schizophrenia. And other personality disorders have symptoms come on a lot earlier in life, like with antisocial personality disorder. Despite these varying differences, they all do ultimately come down to the traits, right? The character traits affected. Personality disorders, of course, are born out of maladaptive character traits, and these ultimately are the causes and treatments for those maladaptive character traits. So that about sums it up for today's video. Thank you so much for watching. I greatly appreciate it. We're coming to the end of the personality disorder series, and I will be touching on relationships with personality disorders, as well as my own personal account of living with a personality disorder. And from there, I will go on with my usual content about psychosis and such. So If you liked this video, let me know in the comments what you think. And as always, if you'd like to support my channel, please like and subscribe. I'll see you in the next one. Thank you so much. Bye.